Hello everyone, my name is Anthony Romero. I'm here on behalf of ABC Medical, and I'm here to give you some information on behalf of the hospital on the benefits associated with community health outreach programs. As healthcare is becoming increasingly value-based, we as an organization are looking for ways to use our resources in the most efficient way possible to meet the needs of our community. One of the things that we've discovered through these efforts is the need to put a larger focus on community health efforts. And by doing so, we think that we can help serve patients outside the four walls of our hospital. Hunger and nutrition challenges, low literacy rates, the lack of safe housing are among some of the biggest obstacles faced by the patients who are high utilizers of our healthcare services. I believe through community-based initiatives, we could help patients get beyond these hurdles to be able to prevent and manage chronic disease and other costly health problems. I believe that this initiative could improve the health of our community at a lower healthcare cost overall. I'll be proposing 2 community outreach programs for you to consider today. The first is using social media for community outreach. Social media is proven powerful in driving community and public health. In today's world, 8 out of 10 patients use social media in their daily lives, and about half of them use the smartphones on the internet to obtain healthcare information. Social media is a simple and cost-effective way for us to get some extremely important information out there. It's an important tool in today's world to communicate public health messages. Social media is helpful in highlighting community partnerships such as rideshare deals for hospital trips or healthy eating and wellness programs within our community. We could use social media as a patient education and outreach tool, informing patients of different community programs geared to improving health. Social media is also useful for gauging patient feedback. Are these community health deals helping patients? How can these programs be improved? Getting all that type of information is very easy through social media because it collects the data very easily and quickly. It's easy for us to extrapolate that information and data for use. The next is going to be conducting a community healthcare or just a community health assessment in general. Community health assessments will take the form of community-wide health survey. The content of the survey will be tailored to be specific to meet the needs of our community. We aim to reach everyone in our community to get the strongest data set. Community members are going to benefit from completing this survey because we'll see stronger bonds between us and the community members, and they'll ideally see their health concerns met much quicker. This survey will allow us to gain a clearer understanding of their community health needs and priorities, increase buy-in and the sense of a shared responsibility for community health, and establish relationships with organizations and individuals who are community assets. Once the survey is administered, we'll collect and analyze the data, and then we'll have our analysts prioritize emerging health issues, document, and then communicate the results back out. Then we can build a plan based off those results to implement solutions for the opportunities that we've identified. And then as with any innovation, we'll have to evaluate progress at regular intervals to ensure the initiatives are met and they're meeting the intended outcome for our community. By implementing these couple of very simple outreach programs, I believe that we could benefit. One of the benefits would be to decrease our reimbursement penalties applied by Medicare and Medicaid for excessive 30-day readmissions by finding ways to help patients stay out of the hospital just by getting this education. This would also be a good measure on how these initiatives are working, as we could see the decrease in readmissions and then the associated penalties over time. Another benefit could be the better use of our ER services. As patients start getting educated through these programs, they start to gain trust and relationships. They'll start to use our other services instead of just overwhelming our ER with non-emergent complaints. This will also be a good measure as we'll see a decrease in the non-emergent care done through our ER. That's just a couple of the benefits that we should see and be able to measure very easily. All the money and effort that's applied in this manner should pay off now and in the future, and be a good success for us and our hospital. Thank you for taking the time to listen to me today. If you have any questions, please feel free to give me a call at any time. I am in my office, and feel free to email. Thank you and have a great day.